Thank you, Vedika and Parth, and thank you to Vishal, and welcome to everyone. And so today, thanks for inviting me to speak on this topic. So we're going to talk about AI and technology in school counseling. So I've been very specific uh, about this because AI and technology in general is a really broad topic, and we can go on about the benefits and also the harms that technology can do. But we'll try and cover how you can use AI and technology in school counseling, and I'll share my experience on how I've used it. So I'm Amritash. I'm a child and youth psychiatrist. I trained in Delhi in UCMS and then in Maulana Azad Medical College. And then I left for England in 2002 and did my membership in CCT in child and adolescent psychiatry. And then I was a consultant in the NHS for a few years. And 2015, I moved to Australia, and I've been a child and youth psychiatrist there for the last 10 years. And then 2 years ago, me and Vishal together started ChildrenPlus. So some outlines. So I'll start with what do I mean when I say AI and technology. I will very briefly touch on technology and AI as problems, and then some AI and technology tools that we can use in our practice. So, and we'll break them down into different um, sub sections, and then we'll go to a list of general advantages, and finally, with anything, you can have pitfalls and cautions, and then a little bit about the personal reflections and what I use in my day-to-day practice. So I'm currently a child and adolescent psychiatrist in private practice in Queensland, in the Gold Coast near Brisbane in Australia. So first, no AI was used in the preparation of this presentation. So I wrote it myself. So because I did this, what did you say? I prepared this presentation. What did I use? So I used the remarkable tablet, or you can use pen and paper. For the past few years, I've been using this as a replacement for the lots of notebooks that I used to use. I use PowerPoint, of course, and a bit of Google search. I didn't use Gemini. So the other thing is, please feel free to stop me and ask questions at any time, and there'll be time at the end as well. But you can stop me at any time. And then obviously this presentation is not a shameless plug about the benefits of AI, just how you can use it. And then hopefully it'll get you thinking about how you can incorporate AI and technology in your day-to-day work. And then finally, and most importantly, AI, using it or not using it doesn't make you a better or worse therapist. So that's just you. So broadly, we define AI as using a number of smart, and I put that in inverted commas, tools using computation power to streamline or automate processes and make our working lives more efficient. Or it's just using tech to save me time or make my life easier. Or if you're a manager, using tech to save my counselor time and make my life easier. And why is AI important? Because all of us know there have been really rapid advances in AI. And I certainly find myself sometimes getting a little bit of FOMO, that I either get on board or I'll get thrown out and get behind the times. It certainly has the potential, or we can say definitely will change our work lives for the better, worse, or lead to judgment day, depending on what your perspective of AI is. And this is a matrix reference for this likely my age. So tech and AI has problems. I think what problems can cause. So smartphones and social media, they represent the biggest change, or the single biggest change to our lives and definitely our young people's lives over the last 20 years, and some would say even longer. So if you must have seen how people's lives, even our lives, have changed. From 10 years ago, no one would spend any significant time on a smartphone, and now the average uh, time spent, uh, screen time spent. Any guesses? Good, yeah, 7 hours. 7 hours is the worldwide average. Yeah. So, so we spend a lot of time in front of the screen, and the vast majority of it is in front of our phone. And that's the other change. So we used to use laptops and other things, but now it's primarily our phones. And then AI supercharged social media like Instagram, Snapchat, YouTube, TikTok. They use algorithms and they know a lot about us, and they control what information that we see. Um, there's been a significant rise in sorry. Yeah, there's been a significant rise in internet and phone addiction, and then the rise in mental health disorders amongst young people has been very significant. So from 2005-6 onwards, some would say almost with the onset or the release of the iPhone, um, disorders have increased significantly. And I think now in adolescence, the disorder rate is 25 to 40%, depending on what study you look at. Anyway, so general principles. AI does not make you a better therapist. It might make you a little bit less stressed and save you time. Finally, if you do use, how many people do use AI or AI generated notes? Yeah, quite a few, right? Do not let AI generated notes decide your clinical decision making, because the note looks beautiful when you look at it. But it is, at the end of the day, a summary of your session and your impression that has been passed through an algorithm. AI is there to help your day-to-day work, not do it for you. Although some people fear that it might do it for us after a bit. AI can be a massive time saver. So especially in note-taking. And meeting summarizing, I think that's the most common use that people have had of AI. Different types of tools can help with different parts of your work. So maybe we'll go through how you can put a few of these tools together with the minimum possible cost, because a lot of these tools come with a significant cost as well. And finally, not using AI does not make you a poor therapist. Okay, so transcription and note taking, that's the first bit, and that was my pet peeve. At the time I was spending doing notes, writing notes, transcribing them. So most people, so we can think about the tools in two different ways: in session tools and post session tools. So in session, Microsoft Teams, Zoom, so people use them. Yes? No? Yep. Anyone use TurboScribe or similar? Yep. Yeah. So TurboScribe is basically it's not note taking; it's a transcription software. And then there are other tools which go a little bit one step ahead, and they'll summarize your notes for you. And so Suno, Tali, Heidi, Lyrebird, Patient Notes. I mean, I've highlighted Heidi because it offers a free, no cost version as well. And then there's Live Transcribe for Android users. And I'm not an Apple user and I haven't been for many years. Is there a similar thing that you can transcribe on Apple devices? Anyone use Apple? iPhone, yes. Is there a transcribe function that if you... Yeah. So live transcribe is, or these transcription functions can be helpful if you are listening to, you're in a meeting or listening to a lecture and it's not on Zoom and they're not summarizing the meeting. And if you did want to transcribe it, then that can be helpful. And post sessions, drag and dictate. This is a software I have used for many years. There is a cost to it. There's usually a one-time cost. But this does mean that you have to write beforehand, and then dictate your notes after the session. But equally, now Microsoft Word, Google Docs, Dictate, they all have dictation functions. I think the most, and then obviously Apple, Android, and Apple and Android have record functions as well. So you can record and then it transcribes it for you. And the biggest concern I hear from therapists and doctors is that I like writing notes and then I like typing them because I'm not sure how it'll turn out if I talk to it. It'll turn out fine. If it doesn't turn out fine to begin with, you practice and it'll turn out absolutely okay. I mean, there was a time when I was just using Dragon so much that I used to use, I would inadvertently start speaking like it in conversation. So I would often say, and then I went to the shop, and you're not supposed to say that. So, these can be massive time savers, and that's the biggest advantage. Yes, so there's nothing wrong with sitting and writing notes, right? They are generally more secure than paper notes, so you can't leave your notebook. People can leave their notebook in the bag, and the bag gets lost. And then the risk is that all your notes with patient names and intimate details are out there, and it's potluck if they. And then the other thing is notes get done straight away. They don't rely on your memory. So I certainly know that when I didn't use these, and if I didn't do the notes straight after my clinic, and if I waited for a week, there would be 60 patients that I would have to think, who was this patient and what did I write about them? So, and then finally for me, a big thing is it's not dependent on your handwriting. So I would really struggle after a while to understand what I had written if I wrote it a few weeks ago and it didn't have that context of memory with it. You're not scribbling during a session. You make more eye contact, spend a bit more time with your patients or clients. And then some software like Drag and Dictate will automate repetitive phrases that you use all the time. And that you find yourself dictating again and again and again. So for example, I discuss a lot of certain medications with patients, and I might say, so if I'm discussing sertraline, I programmed it into my system, and I'll say sertraline discussion, and that will give me a paragraph of what I had discussed already with the patient. So pitfalls. You must have written consent to record a consult. Yes, if you're doing transcribing, you are recording the consult, whatever you may think, but that it's recording. And for young people, that would generally mean getting consent from their parents. So I don't think it's okay to ask a 12-year-old, is it okay if I record your consult? So their parents, and that in schools can be worked around by parents giving blanket consent. But certainly, if I suspect if you're seeing someone as a counselor at school, their parents would know, and they can consent. The problem is they can be hacked and left open, and all your case notes are then exposed. And then this is a big thing. Transcription is not always accurate, so it depends on how good your recording equipment is, how far away it is from when you were speaking, and how much background noise there is. There are workarounds to all of these things. You can get some really good noise cancelling speakers. They will cost a lot of money, but it is really important. The transcription can also struggle with multilingual consults, but it's rapidly getting better. So you can have, because a lot of consults in certainly your practice would be Hindi and English. or Hindi and English and another language or multiple languages. But transcription used to struggle with that, but not anymore. I think you can get some really good notes. Right, and we've certainly done it in Children Plus, that you can use multiple. You can use the software picks it up really well. And you must check your local organizations, so schools, state, country laws on storage and recording of consults. So certainly in Australia, the health authority decrees that the data must be stored in Australia. So your servers must be in Australia. So similarly, if there is a similar law that applies to India, or if India subscribes to, say, the HIPAA, AAA compliance laws, then that should be fine. But just you must always check. So if you're working as a counselor in a school and you want to use AI, you should be discussing it with your line manager, and must have signed up from management, and that we shouldn't just start using it in consults without anyone else know, because that can really blow up after. Because you only need one parent to say, I didn't know my son or daughter's consult was being recorded, to create a proper. And finally, you must read the note, because it's not really your note. It doesn't sound like you. It's the AI doing the transcription and making the note.